Hello, I'm Dr. Henrietta Ewart, Director of Public Health on the Isle of Man, and I'd like to introduce my third annual report into the health of the population. It's an unusual report this year in that it poses a question: are we an equal society? Do we know and does it matter? And actually answers those very shortly. We don't know and it does matter. Health isn't distributed equally through the population. There is overwhelming evidence from multiple countries that health has a social gradient. The more affluent and well off you are, the better your health outcomes are likely to be, and the poorer and more socio-economically deprived you are, the worse your outcomes are likely to be. This matters if we're interested in social justice and in having a society where everybody can achieve the best possible outcomes for themselves and their families, which will benefit not only themselves, but also the community in general, the economy, and all other aspects of our lives together. We have, from our previous reports, now got some hard data on health outcomes for the Isle of Man, and we know that for a lot of these, we have very similar outcomes to England. Some we're better, and some we're worse. Looking at our island society, the nature of the island and the way we live, we would actually expect probably to be better on all the outcome indicators, because we don't have some of the issues that they have in England, like the legacy of post-industrial cities, where there are many decades of deprivation to contend with. We don't have that. We also have a wonderful environment with good clean air, plenty of opportunity for physical exercise, and so on. So we really need to understand why we're seeing the outcomes we are seeing, and whether the outcomes vary depending on the socio-economic status of different groups within our population. This is important because if we want to improve our outcomes, we can't take a one-size-fits-all approach. We know from long experience and mounting volumes of evidence that the old approach of health promotion, which was that basically if we educate people about what is likely to keep them well or make them ill, they will actually make their own decisions for themselves and their families and change their lifestyles to become healthier. Unfortunately, it's nothing like as simple as that. The wider determinants of health, including the environments we live in and social and economic factors such as our income, our job prospects and so on, are just as important, in fact more so, than the knowledge we might have about how to change lifestyle. Most of us now know what we should be doing to live healthy lifestyles, but it doesn't make it easier to do it, and it's not just down to willpower. We need to understand how these things distribute across the population and then try and address the environment to help everybody to have better outcomes. So my report identifies the evidence from elsewhere and looks at the indicators that we could use to understand what the inequalities look like here. Unfortunately, at the moment, we are not collecting the data to enable us to access most of those indicators. So really this year's report is a plea to say, let's agree what indicators we need to help us understand the situation, and then agree that we will go out and collect the data and routinely publish these so that we can all have a better understanding of where we are at the moment. We can look at frameworks for addressing the inequalities and trying to reduce them. My report sets out some of the existing work around this, particularly the Marmot report, which was published across about 10 years ago. So I hope my report in total will give us some thought about the data we need and then what we can do to address it.